I believe we are live.
Oh, perfect.
All right. Okay, well, sorry, we were a little bit late because Dr. Irgau was saving lives. So, Dr. Irgau, how are you doing?
Good, how are you, Kemal?
Good. So because we own the channel, so we can start anytime we want, right? So, but we are trying to be punctual, but of course we are in medicine, and especially with the surgery, our biggest sometimes challenge is answering the emergencies, and also sometimes dealing with unexpected situations. And I think this morning it was one of those. And thank you for what you are doing, Dr. Gao.
Thank you, Kemal. Appreciate it.
I'm going to open our session. Today is June 18th, 2021. This is our Bariatric Friday event. So we went through several different topics, and as usual, I have Dr. Isaias Irgau with me. I'm going to ask him to introduce himself, and then we'll start the session. While he's doing that, I'm going to text a couple people so then they know about the session.
Thank you, Kemal. Thank you, everybody, for attending Bariatric Friday. I'm Dr. Irgau. I am the president of CHRIAS, or Christiana Institute of Advanced Surgery. My specialty is bariatric surgery, which is weight loss surgery, and I have been performing weight loss surgery now for almost 20 years. And with my associates at CHRIAS, we're actually by far the most experienced group when it comes to bariatric surgery or weight loss surgery in our area. Not only we've operated on thousands of patients very successfully, but actually we've set up programs for bariatric surgery in its modern fashion in many of the area's main health systems, including most recently at the American Surgery Center, which is where we perform most of our bariatric surgeries currently. And the American Surgery Center, as Kemal has mentioned many times, is one of the very few surgery centers in the country that has been fully accredited as a center of excellence for bariatric surgery by several accreditation agencies.
Thank you, Dr. Irgau. So I'm going to introduce our other surgeons. Now, most of the people, they already know who they are. Obviously, they know who we are, but for those who may be just watching this first time, which it's going to be highly unlikely. So we are, again, American Surgery Center and CHRIAS, and this is our bariatric surgery journey. Myself and Dr. Irgau, we are conducting these events, these sessions, and we call these events our Bariatric Friday, and that's something we came up with, and we are going to keep it. From the Surgery Center, from the Bariatric Friday standpoint, the team includes Dr. Isaias Irgau, Dr. Gail Wynn, Dr. Mike Peters, Dr. Rahul Singh, and Dr. George Ibrahim. We also have a colorectal surgeon who works with us directly, Dr. Sachin Wade, and we have our dietitians, registered dietitians. Again, they're also part of the Bariatric Friday, and they are Fran, Amy, and Beth. Their specialty is nutrition and dietitian part of the bariatric, and they are a big part of this program. Now, among all the surgeons, we have more than 10,000 surgeries, and just the past 3 years, it's more than 2,000 bariatric surgeries. This brings us with several different accreditations that's needed for bariatric surgery for the Center of Excellence, and we are accredited by MBSA QIP, Blue Cross Blue Distinction Center Plus, at the Institute of Quality, other than our main accreditation with the AAAHC, and that's what our surgery center does. We, what I was saying earlier, we have several different topics. Now, today, this is our kind of like we repeated our sessions, Dr. Irgau, already twice. So we started last year. There were 18 sessions. And then this year we started in June 2021. We finished all those. Now, I wanted to add another topic, and you know, the way you probably know me better than anyone else. So when we are able to actually provide these at certain level, we want to make sure that we don't miss anything. And sometimes people are shy and they don't actually, especially with the, like morbid obesity is kind of hit by several different angles. So there's the social pressure of having the morbid obesity, but there's also other things that comes with morbid obesity that makes the life more difficult. And all these are where people are very sensitive to talk about. Now, with Dr. Irgau's help, I would like to bring this taboo in, not just for bariatric, but just overall in our lives, and what we don't like talking about, but what we do a lot, right? So between obesity actually almost in some cases being the taboo and having people not understanding this chronic illness, when you deal with diabetes, hypertension, sleep apnea, cardiac issues, and then you have issues with sex. So now, why this is important? Dr. Guy, it's not like I was just thinking about, oh, let's just talk about sex, but it was more about what people are dealing with, what they may be having in their lives that they are not sharing with us. Now, as I was looking for this, for us to be able to discuss, several studies are available. And one of them talks about why bariatric surgery actually is able to improve your sex life. And then this is kind of interesting because 41% of women reported improvements in sexual desire, and at least one half of the men experienced improvement in sexual activity. Now, Dr. Irgau, before I let you take over, the issue, it's not like 10 patients were calling me and then I came up with this. I just wanted to kind of see what may be missing. Because, when I did the session with Dr. Wade, colonoscopy is sometimes it's like a topic for jokes, especially among men. Oh, you're going to have your colonoscopy. Like, we are looking for problems, right? We are not interested in the colon in any other way other than the health reasons. So, but I understand. So it's kind of like sometimes we find some humor in these. And then when we look at the reason why we are talking about sex today, when we look at the reason and what may be missing in people's life, especially when they are dealing with morbid obesity, is something that I actually borrow from WebMD, the top 20 reasons people have sex. And as you can see, sexual motives go far beyond the big three: love, pleasure, and making babies. So boosting mood, relieving depression, duty, enhancement of power, enhancement of self-concept, experiencing the power of one's partner, feeling loved by your partner, fostering jealousy, improving reputation or social status, making money, making babies, needs for affection, nutrients, partner novelty, peer pressure, pleasure, reducing sex drive, revenge, sexual curiosity, showing love to your partner, and spiritual transcendence. So now, all these, if you don't have any physical issues, then you are, as you can see, there are a lot of these that you would like to have a checkpoint, check, right? So it's not like maybe like fostering jealousy, I don't know why it's there, or this revenge, I don't know why it's there. But if you look at it, 80% of this is something that everyone wants to have. So, Dr. Irgau, that's why I actually brought this up, because we talk about well-being for our patients, and well-being is not just being able to lose weight. So we define the well-being as several different things, several different aspects of well-being, and sex is one part of it. As you can see the list, feeling loved by your partner. If you're not able to have sex because of morbid obesity, that feeling loved is gone. So the boosting mood and relieving depression. So like just because you may be dealing with morbid obesity shouldn't be the reason for you are missing out on this benefit. So just wanted to kind of discuss this from the clinical side, what you go through with your patients, what you can tell us in terms of what patients are experiencing. Do they share these with you? And there are some studies I know that you'll make some references. So let's talk about sex.
Sure, absolutely. So when the WebMD list obviously lists what people may say for their why they engage in sex, clearly having a healthy sexual life is part of a general well-being of a person. There is no question about that. The very first slide you showed, Kemal, that was very interesting, is you showed clearly that bariatric surgery leads to an improvement in the sexual life of many of the patients who have undergone bariatric surgery. That's really a very important point that you're making here. Well, when you look at it intuitively, Kemal, it makes sense, right? Because our patients, after they lose massive amounts of weight and they get rid of this burden, they feel a lot better about themselves in many ways. So consequentially, you would expect for them to be happier as well about their sexual life. And it is. In fact, studies have demonstrated that. What is very important to point from that perspective, Kemal, is that how obesity also affects sexual well-being of a person, right? That is really the corollary that we have here. You have a disease, right, obesity, that not only leads to tangible medical and health problems like diabetes, like high blood pressure, like sleep apnea, but this actually affects many other psychological aspects of one's life as well, right? It is no surprise that incidence of depression, incidence of anxiety, and other mental illnesses is actually increased when we are affected by obesity. So not only do we have physical affecting diseases, but we have psychological and mental mental health problems also associated with obesity. And really a healthy sexual life also requires us not only to be healthy physically, but also to be in a better place from an emotional point of view and from a psychological point of view. And obesity deprives us of that. So it is no surprise that when researchers went to ask people that are suffering from obesity specific questions that indicate happiness in their sexual life, the scores were very low for people who have high body mass indices, for people who suffer from obesity. Well, the researchers did this for both men and women, and the results were similar from that point of view, right? The interesting thing that you brought about here, Kemal, is that when researchers went back to people who have had bariatric surgery and asked the same questions, they saw improvement. This was research that asked those questions before bariatric surgery and then followed up questions after bariatric surgery. So there was improvement. So no, obesity, not only it is affecting us organically by affecting our physical health, but it affects our mental health. And guess what? Sexual health really is affected both by physical issues, but also psychological issues. And obesity tends to affect both of them. And in terms of how important this issue is for us to talk about it, Kemal, this is really a very important issue for everyone, right? And yet, both health providers and patients don't readily bring it about, for a number of issues. I mean, I was making the observation that, whenever I do a surgical procedure and we talk about recovery, most patients will be readily asking me when they will be allowed to drive, when they will be allowed to lift weight, okay? But the patients who will ask me about timeline for intimacy are far in between. And yet that may be very important in their mind, but they are reticent to bring that issue. Similarly, the issue of how much obesity is affecting their sexual life is something that we don't hear about. but underneath we know it is happening. And those researchers are really bringing this to light right now, right? So simple issues of how comfortable are you to be undressed, in front of your partner, to how much anxiety or depression you feel when you think about a sexual relationship, you know what I'm saying, because of the issues of self-esteem, because of the issues of performance related to obesity. Those things drag down a person's sense of well-being and sense of happiness drastically, right? And as soon as their self-esteem increases after weight loss, Kemal, once they feel much more empowered about their own, their own appearance, their own physical well-being, then their confidence level increases as well. And though the anxiety and the depression related to thinking about sex decreases considerably, and so does their in terms of their appearance as well. So there is really no surprise, Kemal. But beyond that, obesity does affect some hormonal changes also that have a direct impact on the sexual health of people. So getting rid of obesity will obviously improve those hormonal changes as well.
I think the term prevention, and with the prevention, are we able to predict what's going to happen? So it's not everything that we talk about is what's happening today, but what may be happening 10 years from now, 5 years from now. Now, when we look at the sexual well-being with any individual, so there's one part of it is sex, the other part is, especially for our female patients who are dealing with morbid obesity, menopause is one of the big impact that they have in their life. And with the obesity, this may be even more, the impact may be even more severe. So, and I do want to kind of, I want us to talk about that part as well. So when it comes to female patients, weight gain and menopause, what's the correlation there?
So that's actually an extremely interesting and important point, Kemal, right? One of the frustrations many women face is that they find that at a certain stage of their life, not only is really very difficult for them to lose weight, but they lose completely the ability to control the weight gained, right? Despite the fact that there is no change in their dietary habits and their activity level, once they approach menopause, right, they find that there is sudden gaining of weight. Well, this has to do with some hormonal changes that naturally women go through at a certain age, and that is with decreased activity of the female organs, with decreases in certain hormones like estrogen. That's, it happens gradually, it doesn't happen immediately. That's why it's called perimenopause, which is something that is approaching menopause. And then menopause in when there is complete stoppage of product of the periods of the menstrual cycle related to the changes. And that at menopause, there is a struggle with weight, and that is related with the changes in hormones as well, right? That also does affect many aspects of sexual health. So you have obesity, you have menopause, and it's a combination really that can lead to a lot of unhappiness and dissatisfaction, not only because of the weight gain, but also because of the changes menopause brings about as well, right? Now, if you add to that obesity and what obesity can do to one's sexual health, you can understand how these issues can become superimposed to each other, essentially, Kemal. So it is not surprising that these two issues are related. And in my experience, when I talk to women, very often they will talk with frustration on how they have lost control of their weight once they reach the menopause stage.
So again, Dr. Irgau, I think from the female patient standpoint, preparing for that time, and a lot of our patients, they are in their the range of like 30s, 40s. I would say 70% maybe are patients in that, where in some cases weight gain may actually push the time for menopause to an earlier time.
Yes, absolutely.
And if it doesn't do it, it can make it even more complicated, especially when they have to deal with so many different things during that time. With the obesity may be making it a lot worse than what it is. So that's why I'm always looking at these from the prevention standpoint. So what we tell our patients, what's going to happen today versus what may be happening in 10 years is something that we have to really think about. So our metabolism, the speed of our metabolism slows down. Now I'm 47 and it's not the same as I was 25 in terms of my the way that my body burns fat, right? So I have to eat less and I have to move more to maintain my weight. So in order to do that, in fact, like the last 2 months, I'm walking close to 5 miles every day. Excellent. And it's still not happening right away. So it's a complicated, complex situation. So, and today, it's interesting, Dr. Irgau. So you were at the hospital. You weren't able to see that part. We had one of our patients dropped out of the program, and with our nurses, I had to kind of point out. There's always this, perception that we fight, right? So the perception is, oh, we want everyone to have surgery. That's not the case. Mm-hmm. Mm-hmm. This patient's weight is 363. Mm-hmm. So just so that, because we see these patients every day, sometimes it becomes like it's the norm that we deal with, but that's not the norm, right? Yeah. So. Yeah. And I'm like, why would she drop out? I look at her age. She's, I think she was 38, 39. Mm-hmm. Mm-hmm. And all I'm thinking is, and then because I was also preparing for our session, I'm like, so what's going to happen to this person 5 years from now? Mm-hmm. So with that kind of weight and then no help, because that patient is not going to be able to lose weight by just walking 3 more miles a day. No. So, and really just looking at it from the overall impact in our society and educating people. I mean, even, obesity itself was a taboo that you weren't able to talk to people. And I still see, in some cases, primary care physician let the patient go from their office with 47 BMI. Well, hello, like, are you going to talk about the morbid obesity? Yeah. Oh, well, you have diabetes, you have hypertension, because you complain about those, or just because you don't complain about obesity, or you don't complain about issues, maybe potential issues with the menopause, potential issues with your sex drive, potential issues with everything. And we are letting those patients go without any help. That's not an option. So, and we are not going to do that. That's why we are doing these sessions. Today, I was in my office, but you were in the hospital. So it's not sometimes easy to get everyone all together at the same time, and that's why we were a little bit late. But the thing is, this is what we do. Like, it's not, this is our way of reaching out. So I'm really hoping that we can educate more people and make them understand that this is not another case added to the pot, but it is another person that we are able to help, and we are able to save their lives, or we are able to, in fact, make their life better and the longevity of their well-being better. So that's kind of like our goal. And I'm hoping that this is helping our patients. And, just from, Dr. Irgau, one of the other things is that when we look at the patient surveys, now I have some updated number from June. Mm-hmm. And the only reason we are sharing this, of course, we are promoting our program. There's no question. Well, that's my job, right? But behind that, beyond that, actually, what we need to see is while I'm doing my job, while we are doing our job, we have happy patients. So if this is from the recommendation for the facility for their family or a family member or friend, if we are at 99.4%, and then and if these people are seeing the benefit, the experience, why not share this with other people who are fighting with morbid obesity? So that's kind of like our goal, and we want to actually add different topics, even if they're not coming to us. We know that people are dealing with, and so that's kind of like hopefully that makes it that opens maybe some more channels for some other people to look into this in different way. So Dr. Irgau, anything you would like to add?
Absolutely. So first of all, I want to say this is an important topic, Kemal, and I want to thank you for bringing it up. The important thing to make clear here is, if we ask the question, does obesity affect one's sexual life in a negative way? The answer to that is yes. And many people may have been unhappy with their sexual life in terms of, psychologically feeling anxious, but also physically not feeling that they are doing well. All these, they may not have related it to the obesity, right, Kemal? But clearly it is related to obesity. And then the next question after that is, will sexual life improve? Will there be much more satisfaction in one's sexual life after weight loss surgery with bariatric surgery? And the answer to that is definitely yes. And that's not something that we are saying because we've observed it in our practice, but research has been done on a number of times, Kemal, where people have been asked very well crafted and verifiable questionnaires, that people were answering openly, and those have shown that people really were much more satisfied after bariatric surgery and with adequate weight loss. So just as there has been a lot of stigmatization of obesity, Kemal, and issues related with obesity, there is stigmatization on this issue as well. And yet it is affecting a person's well-being. And it's important that as clinicians, as healthcare providers, we really bring this issue, or encourage patients to talk about it and to tell them that there is a way out, that it's not necessarily their fault, it's not necessarily who they are, but that the circumstances, particularly obesity and the impact of obesity, is affecting this part of their life and well-being as well.
Absolutely. So Dr. Irgau, I just want to make sure that I share our event schedule with our audience so that in case they haven't seen this. So Bariatric Friday, 90% of the time, Fridays at 1 p.m. Our weight loss webinars, seminars, that's second and fourth Tuesday, 6 p.m. UMACU, United Medical ACU updates, that's 12 noon every Friday, and Wednesday wellness webinar, second and fourth Wednesday at 7 p.m. Now, we also have our support group. If you are a patient of CHRIAS who had the surgery from CHRIAS, that meeting, the support group session is first Tuesday at 6 p.m. Every month. So, and again, when you finish all the boring sessions like shows on Netflix and nothing to watch, you go to our channel, and then we upload these, and then you can get a lot of interesting learning from here. You don't actually necessarily have to have morbid obesity to watch these, but someone in your family, someone in your friend of yours may be having it, and understanding what they may be going through. And there are a lot of learning in terms of clinical side of this, and I believe we are actually reaching out to so many people. Dr. Irgau, thank you for joining me today, and I know it was a hectic day, but it's always good to have you, and we'll be back next week. And until then, please stay safe. Thank you.
Thank you.